You said it well, so ditto. No, I'm just kidding. Suffice to say a couple of things. So, Aura did a tremendous down payment on health information technology. Aura did a tremendous down payment on prevention. Aura did a tremendous down payment on some activities with NIH, as well as jump-started the comparative effectiveness research agenda. My point in saying that is that there are a lot of things that are already on their way, and Ruth is right, and I would the view health reform, the PPACA bill as almost a second wave of activities, if not accelerated wave of activities. Here's the bottom line. In all of these things that we're talking about, whether it's going to be the effectiveness of the community's prevention, more dollars, whether it be the effectiveness of the monies for health information technology, whether it be the effectiveness of all the monies that are encapsulated in different activities within health reform, if there is a lack of engagement by minority communities, minority providers in any of these things, then it will be, the end result will be lost. And so if you look at, there's some interesting data about looking at potential benefits of health information technology, and it has a lot of potential benefit. But without any engagement, none of those benefits will be realized. So my point in all of that convoluted response is to say that there's the unique sliver that goes through all of that is engagement and understanding. And if you look back to some of the activities that occurred in 1963, 1964, 1965 with Medicare, and then some of the challenges that Medicare faced afterwards, as well as other kinds of policy-related things, all of this has to do with people understanding what's going on. That's where we need everyone's help. We need people to be engaged in active outreach, as if this was, because this is the time in terms of outreach. So we really do need all the partners, all the engagement, all the questions, all the answers, all the everything involved, or else the boat might just miss its target, and it's really, really going to be about community engagement. Thanks.
Thank you, Garth. Any other burning questions? Yes.
Well, since you mentioned outreach, my name is Nyla Gover-Badu. I'm a social worker in Maryland. I work for Primary Care Coalition. I wanted to know what is being done to enroll Latin American small business owners that may qualify for the healthcare subsidy. What is being done to get them healthcare so they can get healthcare for the owner and for the employees?
Right. So there's been a very interesting effort, even before this legislation targeted at small businesses. The White House had a very concerted effort trying to have a small business call, small business meetings, targeted chambers of commerce, all of those things. So there's been a real direct focused effort targeted at small businesses, because they're the crux of the insurance enterprise, right? If you kind of think through it on a financial level. So that's been ongoing. That started when the percolations of the law was in its very germane form, in its infancy, and then I think has continued through with a number of ongoing kind of White House engagement, White House briefings, and things along those lines. That's at the 10,000-foot level. HHS is about to embark on a process where we go through activities at the regional level in terms of organizational structure. So there's a concerted effort really built into this from the get-go, targeting small businesses, and certainly that's a meeting where we invited small folks from various communities to come in, and they get briefings from a lot of people at the White House, myself and other folks, to talk about these kinds of things. So that's ongoing. Truthfully, I would say that right now a lot of us are vested in the implementation of regulations, and so we might not do a good job with the PR portion of it as we would like to do, and that's where y'all come in to help say, oh, that sounds good. We're going to talk to grandmother, aunt, uncle, rich guy around the corner, all of the kind of folks who are involved in all of these kinds of discussions, because that's how things get spread, and that's how people start to understand.
Yeah, and like I said earlier, we did have the National Hispanic Medical Association had a meeting yesterday with the department just on that, on outreach and how we can be of service to tell everybody else here, we need your help, because they are going to start having regional campaigns over the fall from September to November, after they put some of these regulations into place, some of the new changes, so that all our communities targeted around the country that are uninsured, especially even those with insurance, to know some of the new changes that are going to happen this year. And each of the regional directors, and there's 10 of them around the country, in this region, it's Region 3, they're out of Philadelphia, they are charged with helping to reach out to all the coalitions in their region to let people know about the new changes. So that's going to be the outreach effort that we are beginning to be a part of. Yes?
I'm with the Office of Women's Health at MPA, and I mentioned this before. But many of us are all over the country speaking, and it would be very helpful to have something like what I just found in the package, coming soon for women and their families, coming soon for Hispanic communities, coming soon for seniors, with just simple bullets that would be not only talking points, but handouts.
Marsha, in the healthcare.gov website, we did ask that they start, instead of a timeline over the next 10 years, they start putting what's in it for everyone now, in the next 3 months. And every 3 months try to update that. And that's what they're working on, those fact sheets now. And whatever we could find, we put in there that the prevention stuff's come out, and some of the insurance changes, the Patient's Bill of Rights. The White House had a big event for a lot of the health professional groups just in the last month, and that's in your packet too. And there's a lot more on the www.healthcare.gov. We're
So
going
by
to...
September, you think that would be?
No,
It's
yeah.
happening now. A lot of that's happening now. So I would say a lot of those fact sheets a lot of those are all on your website, actually. And even better or more updated fact sheets will be in early August, will be on.
And they are categorized by different subgroups, so women, children, seniors, minorities, and rural and disabled. So I think there's a lot of work being done. We just have to help get it to our communities. And that was the whole point of this discussion. And again, I want to thank all of the speakers. I want to thank ARP for your sponsorship. I want to thank Congresswoman Lucille Roybal Allard for being the champion that she is as the task force chair for the Congressional Hispanic Caucus. And I want to thank all the staff who helped, who's here. That's Aliaska, Brandon, Lucy, I don't know if Caleb, back there. Thank you very much. We have food and drinks in the back. Please stick around and we'll talk to the speakers individually. Thank you very much.